Introduction to Physiotherapy. Introduction to the module. This module will introduce you to the fundamental concept of physiotherapy, its history, and its importance to today's healthcare systems. The topics to be covered. What is physiotherapy? Origins of physiotherapy. Introduction to kinesiology. What is physiotherapy? In fundamental terms, physiotherapy is a specialized treatment where a person's physical functions and overall mobility are improved beyond the currently impaired status. This is achieved with a mixture of processes which include various restorative and fitness-driven activities. A trained physiotherapist can significantly contribute to a client's care as they possess a fundamental understanding of the human's body capacity for recovery, movement, and its anatomical abilities. As a result, physiotherapy is considered to be an independent and client-centric practice that can improve personal physical performance, control and manage pain and disability, promote the advantages of health and well-being. Physiotherapy firmly originates from scientific methodology rather than spiritual or alternative medicine theories, despite some perceptions. Practitioners in this field are known as either physiotherapists or physical therapists. Physiotherapy is also marked as a form of treatment that can safely be used with other medical procedures. This is mainly because it usually requires no surgical or medicinal applications in addition to others already being performed or scheduled. In fact, it has been proven to significantly complement some forms of medical techniques and enable speedier recoveries. The main objective for any professional physiotherapist is to improve a client's quality of life with the appropriate advice and physical manipulation. Whilst they will perform the direct treatment to alleviate pain and enable recovery, they will also encourage clients to assume ownership of their rehabilitation with health and well-being recommendations. A physiotherapist will be skilled in assorted manual therapy methods, therapeutic exercise, and other medically appropriate treatments. Typical clients can include anyone from babies with congenital mobility issues, adults with muscle pains and cramps, athletes with sports injuries, older people recovering from strokes. Origins of physiotherapy. Although forms of manual therapy have been recorded throughout the years, the first documented example of systemically recorded physical therapy originates with one of the first teachers of physical education, Per Henrik Ling. The Swedish educator founded the Royal Central Institute of Gymnastics, RCIG, during 1813 in Stockholm and extolled exercise and physical manipulation virtues. Sweden led the way in this treatment, and practitioners were given an independent role, gymnast. By 1887 they needed training and registration from Sweden's National Board of Health and Welfare. The UK eventually followed suit, and in 1894, a small group of 4 nurses formed the Chartered Society of Physiotherapy. Physical therapy was adopted on a more global scale as the 19th century ended, and worldwide conflicts started to affect the well-being of huge numbers of patients. During the First World War, it became common practice for women to work directly with severely injured soldiers to restore their mobility. They were often called reconstruction aides, but this was the first international example of critical physical therapy. After the end of the war, a school that taught physical therapy was established at Walter Reed Army Hospital in Washington, D.C. This further popularized the treatment and subsequently led to substantial research in 1921 called the PT Review. Introduction to Kinesiology. Typical physical therapy uses kinesiology alongside other health and fitness routines and treatments for client evaluation. This is because it can greatly aid the treatment of injuries and conditions that affect movement on a physiological, biomechanical, and psychological basis. This is especially effective for ailments that originate from the musculoskeletal, respiratory, cardiovascular, or neurological systems. Kinesiology, in its simplest terms, is the scientific-based study of human movement from a physical or mechanical, due to the joints and connections, perspective. Looking at the human body as if it were purely a machine designed and capable of movement means that three areas are focused upon. 1. Mechanics, biomechanics. 2. Anatomy, musculoskeletal structure. 3. Physiology, neuromuscular system. These three disciplines comprise the core studies of kinesiology and the basis of human movement. It is sometimes considered to be a separate science and can be separated in essence from physiotherapy, but the fact remains that it is an extremely important part of understanding human mobility. Importance of kinesiology. The principles of kinesiology help therapists, coaches, and teachers understand the prime components needed for elevated forms of mobility and can increase performance or aid recovery procedures. It allows a professional to create or refine specific activities that will positively impact their clients' current levels of mobility or fitness. Whilst it might not initially seem like it, it is primarily a cause and effect science utilized for great results. So, the practice and knowledge of kinesiology is not only useful for identifying appropriate physical activities for recovery but also for improving the abilities and limits that an athlete or individual is keen to master. Kinesiology to the physiotherapist. The differences in the use of kinesiology become more apparent when a physiotherapist's objectives are directly compared to that of a sports coach or trainer, although beneficial exercises will result from the science for both parties. A physiotherapist will aim to restore a person's mobile functions to a level considered adequate or effective. At the same time, a coach or trainer will push their client to levels above that definition. So, a physical educator will use kinesiology to improve basic movements of the normal body, but a physical therapist may use it to focus on restoring movements of a body that have been impaired by injury or disorder. Summary. This module has covered the following points. Physiotherapy is a specialized treatment where a person's physical functions are improved beyond a currently impaired status. A physiotherapist can use their knowledge of the human body's anatomy and systems to treat clients or patients. Physiotherapy principles are based upon pure medical science and are not considered alternative medicine. The study of kinesiology focuses on the scientific principles that allow the human body to move. Kinesiology can be used to aid in the improvement of athletic prowess or the restoration of basic human movement.